Now, Ebola isn't the only infectious disease that's a threat to travellers during this and every summer season. Our Kwon Soa gives us a rundown of which diseases to watch out for before we embark on a trip.
No matter how slim you think your chances are of contracting a dangerous disease, prevention is always better than having to rely on a cure, especially as the world becomes smaller and people travel more. But even those who never leave the country can pick up something nasty, as there are more and more people catching contagious diseases in Korea. In fact, according to the Ministry of Health and Welfare, the number of measles patients this year stood at 410 as of the middle of last month. That's nearly 4 times more than the number recorded over the whole of last year. What's noteworthy is that only 14 of the 410 patients came down with measles abroad. Over 350 cases, the vast majority, caught it as a secondary infection in Korea. This is why taking the required vaccinations and medicine is so important. The most serious and contagious diseases are commonly found in Africa, the Americas, and Asia. The yellow fever vaccination is mandatory when traveling to any country affected by the viral disease, while all the others on the list are recommended. Malaria, for example, which is mainly transmitted by mosquitoes, can be prevented by taking anti-malaria tablets before, during, and after trips to affected areas. Unfortunately, there are still diseases that can't be prevented medically, as can be seen in the recent outbreak of the Ebola virus in Africa. The Korea Centers for Disease Control and Prevention says basic methods such as washing hands thoroughly, eating cooked food, wearing long sleeves, and staying away from animals give travelers the best chance of avoiding getting sick. Kwon Soa, Arirang News.